Well, I took the chance to actually start with a little short presentation about our organization and how we are kind of working. And my name is Lise-lott Eriksson, and I am the CEO of the Swedish Blood Cancer Association. I used to also have being the chair of the organization, but now I'm only the CEO of the organization since this last weekend. So the Swedish Blood Cancer Association is an organization for those that are affected by blood cancer, their relatives and caregivers, and also we have some from the hematology staff. And we are over 5,000 members. We have 16 local associations under the umbrella of the Blood Cancer Association. And those are geographically organized. And since we are a blood cancer organization, we actually cover over 120 diagnoses, and the majority of them are rare cancer diagnoses. Our focus areas for the organization is policy and advocacy. We work a lot on interest policy advocacy and try to do better things for the blood cancer patients in Sweden. We also work a lot on research and development. We also are very involved in patient empowerment and patient rights, and I will come more to that. And also we have one focus area with business development, where we try to, we have just hired a person that work with the local associations and the members, marketing, fundraising, and also communication. And there we have our member magazine as well. Next slide, please. So we started out to do a member survey to actually see what our members thought was the most important areas for us to work in and to have advocacy activities. And that turned out to be that the patient, 96 of the members thought that it is very important that people with blood cancer have access to new innovative treatments. And we have an institute that made a member survey, which is a very famous institute, and they said they have never seen anything like that when they have done previous surveys. So this is very, very strong, they thought. And to consider, it is so important that people that are affected by blood cancer really have access to new medicine. Next slide, please. And also, the members thought it was so important to have access to clinical trials. And 83% of our members, they really want to be in a clinical trial. 30% have got information about the trial, but only 21% has been in a clinical trial. So the strong positive attitude doesn't really correspond to how many people that really want to be in a trial, as you can see. Next slide, please. So what we really try to focus on is to actually focus on research and development, and to have that to clinical trial. And the next thing then, really have all the new innovative treatments that are effective and we see good evidence for, that we get, that patients get access to them. And the implementation, that is really something that is so crucial. And I think when you are talking about it, it's not just in Sweden, it's all over. But actually, I think it's so really important that we work for it for the patient's sake. And next slide, please. But to come back to the patient empowerment, one that we really are going to talk about today, just to show an example what our organization do in that area. We talk about patients' right. We also try to get involvement in treatment option and choices. We have national guidelines for treatment, and we try to really get patient involvement in those guidelines. We try to get patient involvement in patient journals and data. And we also talk about and give information about contact nurses. On our website, we have information about contact nurses, second opinion, treatment plans, side effects and complications that you can get from treatments. We also have information about rehabilitation, research, clinical trials, how to get in clinical trials, drug development, for example. Next slide, please. And to do all these, we have done and we do a lot of YouTube films and movies. We have podcasts. We have on our website, we post a lot of information. We also do diagnose brochure that you can get in your hand. And we also organize a lot of support groups. We have Facebook groups. We have a lot of social media. We are very active on social media. And we also have a system for support persons, like a buddy system. And also we have our member magazine, HEMA, that I mentioned before. And you can just see on the right-hand side, this is just a picture of the diagnosed brochure we have for AML. And also you can see some just pictures from the YouTube films on cancer-related fatigue and also rehabilitations. So this is just to give you a first look what we are doing in this. Next slide, please. So this is just a shortcut of what we maybe could focus on in our discussion, to talk about what is needed in the field for treatment options, self-care, emotional support, and community support, and what we have today, and maybe how we also can work together to get this better, and how we maybe can find best practice and so on. So next slide. So with that, I just want to open up the discussion and ask all of you, maybe it would be very interesting to hear what you are doing in this field, and we can maybe start with the treatment option. So please come forward.
Yeah, thank you, Lise-lott. Thank you very much for this very clear overview. I do have one question, because sometimes, I think once a month, I received requests from patient organizations or from patients by themselves, and mostly in countries with a low income or the middle low income, often from the eastern part of Europe, that they don't have access to all of the treatments which are available. How do you also receive such kind of requests, and does somebody know how to handle that? So sometimes I transfer them to one of our hematologists, or sometimes specific when it handles on drugs. I try to transfer them to our international pharmacia in Switzerland, but sometimes we can't help. So maybe somebody have good ideas.
Yeah, I would say from a Swedish perspective, we have such a problem, both on national structure and also on the regional structure. And to be able to have access to treatment, first, we need TLV, which is the Health Economy organization, or that do the health economy evaluation. They need to approve it, and then the new therapy agency need to give their recommendation. And after that, we can have access to treatments. But if there is no positive recommendation, there won't be any use of the new treatments. And even though there is a positive recommendation, the regions on the regional level, they have their own kind of health economy evaluation, and they might not use the drugs anyway. So it's a really complicated and an administrative way of doing this in Sweden. And we get a lot of such, requests that you were talking about as well. So, and we really try to push and advocate for, a better and less complicated way, and to really have that patients should have access to new, effective, innovative drugs.
I'd like to compliment you on what you're doing. I am not in an association. I'm an advocate with ALAN and with Know AML. I have very strong opinions about clinical trials and treatment options. So I'll just tell you what they are. The first thing, it doesn't matter what your age is, at least from my knowledge base, the first thing for an AML patient to get is the benefit of having a real mutation test. Mm-hmm. And that's not available when you have a regular oncologist rather than an AML. So the first thing is getting detailed tests. And since I got sick and was given 1 year to live 8 years ago, there were like 6 or 7 personalized treatments for different mutations that they weren't available when I started. Number 2, the biggest surprise that I had during my journey was that you may know my story, that I just elected a clinical trial rather than any kind of medicine. And that was my option. Now, commenting on what you said about the complexity of a clinical trial or the complexity of personalized treatment, that goes way back to protecting people from unscrupulous people who are testing people without their knowledge. So the complexity of getting someone into a clinical trial makes sense to me, and generally that's okay. Now, the biggest surprise was I was on a clinical trial for 3 years. And in the middle of that, I was the speaker that announced my drug as being approved in the United States. Crazy thing happened. After I spoke, the president, the CEO of the company came down. I had met him once, and he thanked me for thanking him and thanking my doctor and thanking my wife, who's my caregiver. He said, "You forgot something. You forgot to thank yourself." And certainly not something I even thought of. And I said, "Why would I do that?" He said, "Ralph, you don't understand. In the United States, only 2 or 3% of clinical trials are the elected first option." He says most 97% of the time, it's a last-ditch effort. And so if I had the ability to change things, I would say, make clinical trials. First, get the mutation tests and get personalized medicine, which is different in different countries. I understand that. But make clinical trials maybe not as tough to get enrolled in.
I think I'll jump on that from Ralph. So I work for Leukemia Lymphoma Society. And so, clinical trials are a big push for us, right? We want to fund the research. We want to make sure that patients are getting access to the treatment. So one thing that we have here in the US with LLS is we have something called a clinical trial support center. So we have clinical trial nurse navigators who will actually do personalized searches for patients in the US and Canada, and then help them really nail down what their options are, talk with their treatment team, and then go through the process of helping them get in contact with the trial coordinator, get them enrolled if that's what they need help with, if their treatment team can't do it. So I think that's something that LLS is doing to try to really help patients figure out, is clinical trials an option for me, and then help them get through that process of getting enrolled if it's appropriate.
Yeah, I kind of agree to that. And also, I think that for some patients, actually the only way of getting access to the new treatment that they would get when they have done the diagnosed test that you were talking about, Ross, would be a clinical trial, actually. So I think clinical trials are very important, actually. Tracy, I see you are raising your hand.
Yes, thank you. Coincidentally, I just got off a call this morning with Hemavant, so a company that is the MDS Foundation in the States is helping to spread the word of their trial. It's an MDS, but I was talking with an MDS Alliance member on that call, and she's from France, and she was talking about how it's very different. The rules are very different in how you share information about a clinical trial in different countries in Europe. And I was wondering if that's the case in Sweden too, because she was saying that sometimes it doesn't help to go direct to patient, that you really should be going to the doctors, and that there are different rules in place where you actually could, you're not permitted to share information on clinical trials. Is it that way in Sweden?
We can share, the patient organization can share the information, but also there are some websites that have launched, one of them called HICS, which is a kind of initiative from the branch organization for pharma company, actually, to launch a website for patients to do the search for clinical trials in a very, very easy way. Because the other one, the clinicaltrial.gov, is kind of complicated for patients to do their own search for appropriate trials. So we
I'll say one thing I forgot to mention was when I got the mutation test, I got a call from our doctor and said, there's an option for me. And that was a very clear part, that the doctor expressed very clearly that it wasn't her decision. And so from what I understand now, and I'm being treated every month, so I'm keeping up on what goes on. There's all this collaborative thing going on in the major hospitals where before they give somebody a clinical trial, they'll talk to 4 or 5 different people in a circle. And it's sort of a quasi-approval system. But the bottom line is, at least in my case, it was my option and not her. But then I got to thinking, why would she recommend it? Or why would she mention it if she wasn't thinking it might be an option? So.
Well, that's good. So if we should continue a little bit to the emotional support, what are you doing for that?
Yeah, like as an organization?
Yeah.
Okay, so we have support groups. I think that's really important. Global support groups, and many of them have gone virtual, which I think is really nice because then you don't have to worry about where you're located. So I think support groups are key. Pretty much everything that you had said on your list that you were doing, all of the social media, the options for people to connect with each other, to share their stories, matching patients that are have similar diagnoses so that they have someone to talk with, especially in caregiver support. I think that gets lost sometimes, trying to make sure that the caregivers are brought forward. Much of what you've said that you do.
Yeah. But I think you mentioned one thing that is really crucial and important, and that is caregiver support. And that is something we have talked about, but we really haven't done much about it. We should. But we are kind of, see that there is a real need for it.
Yes.
And I'll jump in from LLS. So we do a lot of the same things too, right? Like support groups. I think one of the things that we do, so my position is called an information specialist, and we're pretty much all oncology social workers. So we have a line that patients can call, and we can provide them kind of personalized resource information and emotional support. So if they're struggling, they can call us, we'll talk with them, let them process, offer support, then figure out where to get them connected to kind of get them that ongoing support that they're looking for. So we do that. And we do support groups. I think one of the cool support groups that we do is we do something called an online chat, which is done via typing instead of being on camera or in person. And so it certainly is accessible just like virtual groups, but it's a little less intimidating, I think, for some patients, because they can just type in questions and answers if they want to, but they can also just kind of sit back and watch. But they are facilitated by a social worker and very easily accessible for everyone.
So do they get response in the chat in real time?
Yeah, it's real time. So like non-Hodgkin's lymphoma Wednesdays from 8 to 10. And everyone logs in and it's facilitated by a social worker, and they can just type back and forth. So again, just like a support group, except done via typing instead of chatting.
Oh, that's cool. Really neat. Yeah. So you have different time for different diagnoses then?
Yep. We have caregivers, acute leukemia. We cover pretty much all the blood cancers, has at least one a week, including caregivers.
This is Amanda from Cancer Care. We also do, similar support groups, online support, resource navigation, education, workshops, in-person, one-on-one support. So we kind of do a little bit of an array of everything. But I think one thing that's different is that we're pan-tumor. So we really cover all facets of like the cancer journey, really from, first diagnosis to, we handle caregivers, we deal with the bereaved, survivorship, really everything. But, similar to, a few different organizations on here, our services are free as well. We're just pan-tumor, so it's a little bit different, but.
Oh, okay. Yeah, Lizzie.
Yeah, so I have a question really to kind of all the organizations, I suppose, who've kind of described what they do. So imagining kind of a newly diagnosed patient, they've been to their doctor, they've been told the news. How do they find your organization? How do they find you? How do they know where to go to get all this information?
Well, from our point of view, we try to have our, diagnose brochures at the hospital.
Okay, yeah.
And we have given them to the hematology department so the nurses can give the patient a brochure, or they can give just an information. Maybe it's not the diagnosed brochure, but just an information leaflet about the Swedish Blood Cancer Association. So that's, and also, and otherwise it's on the website. Yeah, that they can.
I was just thinking back to kind of my experience, sort of at first you're kind of in the hands of the doctor, and whatever information they give you is where you kind of go first. Otherwise it's kind of, I guess people might come across you by chance if they kind of Google things online. So yeah, I was just just a question really of, because you've got a lot of like good information that like would be really helpful to patients, and I just want to make sure that they kind of know that you guys are all there and that they know where to go to find it.
Yeah, Lizzie, that's the challenging part, right? Yeah. I'm sorry, I was saying that is the challenging part, I think, for all of us, and we hope that the doctors, that they're treating physicians, will give them our information. Unfortunately, it doesn't always happen, so sometimes it's by chance, and you also have to work to empower patients so that they do that search, so that they look for more information, because we can't help them if they can't find us.
Let's take a look at my 9 years. All I can say is drug companies, Know AML, ALAN, LLS here in the United States. The amount of information that's out there now, we started with brochures and things. Now the internet is filled with almost everything you want. And I think the comment is exactly right. How do you find it if you're a patient? How do you find it if you're a caregiver? And how do you how do we educate the doctors to make it available to their patients?
I think that's really the challenge. And I also think one of the challenges as well is that it could be really tricky if the patient are searching for information by themselves, or sometimes they tend to get information that are not updated about the diagnosis, which could be really bad, actually. I
One of
think
the ways
Eric,
that patients, I would say one of the ways patients get to us too is obviously we try to get in the hospitals because you think, right, your doctor's recommending, but the social workers and the nurses can refer to our information resource center, and then we pick up the phone and call the patient. And that way we can get them linked into our supports and services. So that's another way that instead of just giving them the number and hoping that they call us, they can actually do a referral and we'll call them.
Eric. Thank you.
The first question we ask patients after diagnosis is if they want to have more information. And if yes, we work very good together with several patient organizations, and I transfer them to the Know AML website, and I will give them the visit card of the Know AML group, etc. But there's another thing I think important. So for lots of years, I'm trying to advocate for more psychological, oncological support for patients and their caregivers, because I think that's, well, even in our hospital, and I know in a lot of other centers, it's a huge gap, the psychological support for patients. And I think there should be done more and more for those patients.
Yeah. And if we should kind of also talk a little about the self-care part, I think it's kind of actually a little bit connected to the rehabilitation for patients. And how is that in your countries?
Well, that's a good one. I think that's another a huge gap. So I'm trying, well, I'm talking now about Switzerland. I'm trying to collaborate with several rehabilitation centers in our country, but it's extremely difficult. And well, it's also something like I mentioned before about psychological care. Sometimes it's all about money. But I think there's still a huge gap to transfer patients to rehabilitation centers, etc. And
what about your opinion about it? Because I totally agree with you, Eric. It's kind of it's a part where there is a real lack in rehabilitation.
It's important that probably nobody has experiences with rehabilitation after treatment for leukemia. So to conclude,
well,
there has to be some work to do. Yeah.
In my case, I always have to be careful because sometimes I feel being near New York City is a big advantage, and I know it doesn't apply to all the other countries, but I don't know what to say. Self-care is all I have, and that works for me. I went through 2 dark months and then came out of it, and now it's just basically it's a part of my lifestyle to have chemo and to have this. I know I'm offered and whether it's free or whether it's not free. I have counseling available to me, but I just don't use it. I'm not sure why that is. It might be different for different age people, but my opinion is I'm just lucky to have these extra days.
And when we have the community support, and we have mentioned support groups, do any one of you have something else that hasn't been mentioned that you want to maybe bring up in this that we haven't talked about? Because I think we have covered it. No? Okay, thank you.
I think, sorry, I was just trying to think about it, but I think the only thing that I can mention is that making sure that the information that we have for patients is presented in multiple different ways. So I think you mentioned, with elderly patients, so making sure that we have printed materials, making sure that we have obviously online materials, but also printed materials, and we have animated videos. That's, a different way for people to learn. So just considering that people learn in different ways and making sure that we have all of them available.
But I think you bring up a very important thing as well, that you have to have material that is appropriate for all ages, for young people, for middle age, for like older people, and they have different preferences. That is really important. And that is something we talk about a lot, because we do a lot of this brochures kind of. It's a big effort for the organization to have them updated and to do all these. But anyway, we think it's such important for the elderly population, for the people members to have these.
I think also something to keep in mind is like the kind of when you've just been diagnosed or when you're going through treatment, you don't have the concentration to read like a long information booklet. I found videos helpful, especially like narrated videos, because I could just kind of absorb the content. I didn't have to make a sort of active effort to read something. So like you say, having the different ways of getting the information, either printed information or the videos, things like that. I think, that's a really good thing to have.
That is a really good point.